Hi, everybody. Welcome to another Conversations with Cortni and Zach. Today, we're going to be talking about healthcare and a little bit about how the coronavirus has kind of brought some things about our healthcare system to light.
Yeah, definitely. Obviously, one of the main features of the U.S. healthcare system is the fact that so many people get their health insurance through their employer, um, but in the midst of a global pandemic where a lot of businesses are shut down and a lot of people are newly unemployed, what does that mean for people's ability to get the health care that they need?
Right. Um, and I'll just share a quick statistic. So, as of June 9th, 48% of all adults lived in households where at least one person lost employment income since mid March. Um, and those numbers are higher for Black and Hispanic households. It was 53% for Black households and 62% for Hispanic households. And then just again, it was 48% for all households. Um,
Right, and uh, those numbers exacerbate an already present disparity where um, Black and Hispanic households are either uninsured or underinsured at a higher rate than white households in general. Um,
right,
Before the pandemic, about 6% of the white population was uninsured, and about 9% of the black population was uninsured. So maybe we could talk about why people are uninsured, just to start.
like why people in general.
Right.
Okay. Do you have
Um,
some stats on that?
yeah. So one of the big things is that health insurance is too expensive. Their employer may offer health insurance, but the employee cannot pick up their obligation. Um, and so between 1996 and 2006, the average employee contribution more than doubled. For a single person, it went from $342 to $789. And for family coverage, it went from $1,305 to $2,890. And then between 2009 and 2019, premiums for family coverage rose 54%, and the employee share rose 71%. And obviously, we've talked about in an earlier video that wages are fairly stagnant, especially for people in the bottom half of the population. So, rising healthcare premiums means a bigger chunk of a family's income that has to be devoted to health insurance.
Right.
Another reason is they don't qualify for federal and state benefits. Um, and the Kaiser Family Foundation has noted something called the coverage gap, which, when the Affordable Care Act was passed, the federal government was going to reimburse states when they expanded their Medicaid coverage, but 14 states chose not to expand Medicaid. So there are about 2.5 million Americans pre pandemic who would have health insurance if their state had expanded Medicaid. Um, and all of those people would be covered under a Medicaid expansion. Another reason people don't have health insurance is they're unemployed or they lost Medicaid, either because they made more than the threshold, or because their state didn't expand coverage under the Affordable Care Act.
I don't know if you have any stats on this. I don't have any. I didn't get any stats on this, but I know another reason people may be uninsured is that they're working multiple jobs, and so like they have multiple part-time jobs, but since they're not a full-time employee, they don't qualify for the employer's benefit package.
Right, and that's something that I didn't look into, but that's a good point. A lot of businesses don't provide health insurance to their part-time employees.
Right.
Also, I suppose another thing is a lot of people are self-employed, or they are seasonally employed, and so they either only have coverage for part of the year or they don't get it at all.
Well, kind of just when you said self-employed, it reminded me of this. So this year, since the pandemic, between March and late May, more than 40 million Americans filed new unemployment claims, and what made me think of that was those numbers can be, the 40 million can be kind of underrepresented because there's a lot of people who may not have filed for unemployment but still lost their job, or there's people that were self-employed that don't qualify for unemployment.
Right.
And just to kind of continue with that, of those 40 million Americans who filed, 41% relied on their job for health insurance, and then 20% of those people have not managed to secure alternative coverage. I'm not sure where you want to go next. I can talk about how much the US spends on health insurance compared to other countries. Unless you had something else.
Well, I kind of just wanted to touch on like consequences of being uninsured.
Oh, okay. Yeah.
So probably the most obvious thing is that if you're uninsured, you are going to have higher health care costs. Number one, any healthcare visit that you go to, you're gonna pay out of pocket for pretty much the entire thing. And one of the reasons for this, or sorry, the other thing is the hospital is going to charge you more as an individual, because what often happens, and this is one of the big things with Medicare and Medicaid, when you have so many people insured in a pool, the company or the government can bargain with hospitals to reduce the healthcare costs or they can not provide that business to the hospital. Um, and so hospitals are often willing to accommodate large insurance companies and Medicare and Medicaid because there's a huge pool of insured people. But if you don't have health insurance, that's where the hospitals are going to try and make up some of those that lost revenue.
Well, because, yeah, like individuals either can't or don't know how to negotiate prices with hospitals. Like, an individual doesn't really have any power to negotiate prices.
Right. And so I guess to talk about this a little bit more specifically relating to coronavirus, even for an insured patient, a fair health analysis shows that a hospital visit for someone with insurance would be some portion of between $21,936 and $38,755, depending on what kind of cost sharing plan they have. If they don't have health insurance, the cost can be somewhere between $42,000 and $486 and $74,310, which obviously, like, if you had to pay that up front, like, that's one of the biggest reasons people go bankrupt is they have a medical expense that they can't pay for.
Yeah.
And just to provide some other numbers, the Kaiser Family Foundation found that total costs can exceed $20,000, and if a ventilator is required, the median cost for 4 days worth of ventilator support can be up to, well, the median cost would be $88,114.
Nah.
That's a big number.
Yeah. I don't know if you also had this as a consequence of not having insurance, is just the lack of preventative care, which, I mean, preventing healthcare, preventative healthcare is cheaper than, like, healthcare costs after something happens, but if you don't have health insurance, you're not going to be going to get checkups or, you know, going to the doctor if you have small aches and pains or something. You're only going to go to the hospital if it's something unbearable. And
Maybe.
yeah, you know, like, there are things that could have been prevented or not gotten so bad health-wise if people had the insurance and were willing to go to the doctor in the first place, you know.
Right. And that is definitely an issue, is people without health insurance are far less likely to see a doctor, physician, go to the hospital, whatever, because of the expense.
I remember, and it's like kind of sad. I worked campus safety a couple years ago for a college campus, and we would often, it was just protocol, we had to call EMTs if somebody was, like, really intoxicated, and especially if they were underage, so they would have EMTs come check him out. Or, you know, if somebody got hurt, we'd obviously call the EMTs. But, I mean, there were people that like didn't students who didn't have insurance and didn't really understand that like if they take this ambulance ride to the hospital, they're going to get a bill for it. And you know, there's students like, I don't care if I break both my legs, don't you dare call me an ambulance, like, and it's just kind of sad. Like,
Yeah.
it's cheaper to get an Uber ride to the hospital. But yeah, just thought I'd throw that
Well, yeah,
in there.
like it's a huge deterrent.
Yeah.
You want to maybe like go into like what happens when we have like recessions and layoffs and things like that. I have a couple things to talk about with that.
Okay, well, you could talk about that. I don't have.
So obviously for people that lack health insurance, it's big. And with a pandemic, it makes it even more it makes it more stressful and risky, because now not only do you not have health insurance, but there's also like a disease that's out there that is very contagious and expensive to treat.
Well, and the fact that a lot of our like essential workers are low wage workers or part time workers already who, you know, might not be insured or might be underinsured.
Right. And so like even going to work is like you're risking your health and your life.
And if you're already low income, you can't afford to not go to work.
Right. So yeah, it really exacerbates a lot of the suffering that poor people deal with on a regular basis. But a study in the New England Journal of Medicine found that for every 455 people who gained health insurance, one life was saved per year, which, again, it sounds like a small number, but there are, at least before the pandemic, there were already 30 million uninsured Americans. So if we were to insure them, just some quick calculations here. We would save 65,934 lives every year. And now with the coronavirus recession, we have, 40 million more people who have filed unemployment claims, and obviously some of them will get covered. Either they'll be able to remain on their employer's insurance but have to pay the entire premium, or they'll get covered through Medicaid, or there are a couple other programs that offer a limited range of healthcare services that they cover, but there's still going to be a significant portion of that 40 million that is unable to get health insurance.
20%.
20. There we go. Courtney's got the numbers. And so, yeah, that's an added number of deaths. And really, when you think about it, I think the last number that I saw was about 132,000 Americans have died of the coronavirus. But that doesn't include the number of people that have died because they didn't go to the hospital for some other reason. And if you've just lost a job, like Courtney and I talked about, and you no longer have health insurance, you might be scared that going to the hospital is going to bankrupt you, and you'll try to wait it out and see if it goes away, or you'll do what you can from home, and then that may end up costing you your life.
Well, if you don't mind, like, are you
Yeah,
don't mind me
go.
moving on?
Yeah, go ahead.
Just to touch on like our nation's spending really quick. The U.S. spends an average of $3.5 trillion per year on healthcare, which is more than Japan, Germany, France, China, the United Kingdom, Italy, Canada, Brazil, Spain, and Australia combined. And we still lose more people to preventable and treatable medical conditions than any of those countries do. And even though we spend so much more on, our government spends so much more on healthcare than all these other countries, we still don't, not everybody's covered. Which is just kind of interesting, and I'm guessing a lot of those preventable and treatable diseases that we lose so many people to are due to the fact that people don't want, or people can't afford preventative medicine, like preventative care. They'd rather wait till they're on their deathbed to go to the hospital because of the cost.
Yeah, I think that's a definite possibility. That one, I think some of it too is, yeah, they don't get regular checkups, so you don't catch symptoms before they become serious.
Yeah, and that's not everybody. I mean, there's definitely people who just don't like going to the doctor and will refuse to go.
Yeah.
But I also, unless you have something to add to that, I also have some statistics on racial disparities with the coronavirus.
I was actually going to ask you about that.
Okay, yeah. So, yeah, I wanted to look into some of the racial aspects of the pandemic. So, one stat was that in almost 60% of states for which race and ethnicity data is available on the CDC website, COVID deaths are substantially higher among African American and Latinx communities, and like relative to their population distribution. So to kind of break that down a little bit more, the coronavirus mortality rates in the US are 2 times higher for African Americans than they are for whites. And what kind of exacerbates that is the fact that African Americans and Hispanic Americans are already less likely to have health insurance, which makes them less able and less willing to seek treatment. And then even African Americans with health insurance are more likely to live in neighborhoods that have under-resourced clinics. So during this pandemic, with just overflowing hospitals and the need for a lot of equipment, a lot of the areas that minorities are in aren't able to sufficiently like respond to the need, I guess. And in addition to that, doctors have been found to treat African Americans and whites differently. And this is not only with the pandemic, this has been documented previously. Like previous studies have showed that African doctors, even African American doctors, are prescribing painkillers at a higher rate for whites than African Americans, because there's some like underlying stereotype or something that black people feel less pain, and I don't think it's like a consciously racist thing, but it's just that's what the statistics show.
Yeah, it's probably something that's kind of like been taught through like the medical system, and so people kind of do it without thinking.
Yeah. And so, like, during the pandemic, what they've been finding is that doctors have been ordering white patients at a higher rate to get tested, while just ordering black patients to shelter in place and observe symptoms rather than getting them tested. And then our sources will be listed underneath the video. There's a apmresearchlab.org link that I found a lot of that information on. And just if anybody's interested, there's in that link you can kind of search state by state, and it gives a lot of stats on different states' death rates relative to their population. So for instance, since we're both from Michigan, African Americans, who account for a third of the positive tests in Michigan, represent only 40%. Wait, sorry. I'm misreading my own notes here. Oh, okay. Sorry. So, in Michigan, African Americans account for 1/3 of the positive tests. They also represent 40% of the deaths in Michigan, even though they only make up 14% of the population.
So in other words, they're testing at a higher rate than their population and dying at a higher rate.
Yeah. But yeah, if you go to that link, there's other states' statistics available as well, and it's just an interesting article. And
yeah, that's one worth checking out. Should we talk briefly about what this actually means for U.S. healthcare? Like, what should we do to address this?
Sure.
I mean, I think it's tempting, and I, for one, think this is a good indication that the U.S. healthcare system needs, or we would benefit from having a universal healthcare system. And Obviously, that's not going to fix all of the problems, but since one of the deterrents is to receiving care or to even seeking care is a lack of health insurance, ensuring all Americans would help reduce the number of preventable deaths every year. But I think there's also like Courtney pointed out, it's not necessarily just about insuring everyone. A lot of these black and brown communities in urban cities or urban areas are underserved. There probably aren't very many hospitals and doctors that are readily accessible. And so finding a way to deliver healthcare to these underserved areas would also help further eliminate some of these disparities and reduce the discrepancies where black and brown people are dying at higher rates than whites.
I also just want to point out that universal health care can mean a few different things.
Absolutely.
Like some of these other countries with universal health care, Canada, the UK, Germany, whatever, they have different systems. Like one might have the government insures everybody. One might have it where the government insures most people, but there's also private insurance available if you want to go that route. And there's other systems where they cap the prices of healthcare. So there's just a lot of different factors, and it's not the same in every country. So when we say we need universal health care in the United States, that's not just one idea. I don't know.
Right. It's not like
We definitely need reform. But some people might have a misunderstanding of what universal health care means. So
when I think some critics of the universal health care system would say that in America we have better health care. And that's kind of true. I think American healthcare is generally more innovative, particularly because we have a lot more competition. But while we might have great health care, when we have so many people dying because of preventable diseases or injuries, are we really getting the most bang for our buck with the
well,
innovation?
I mean, the healthcare debate in itself, we could go back and forth for hours. There's a lot to it, and there are pros and cons to either system.
But when we're talking about a global pandemic, when we have people dying in excess of what we normally see, could those deaths be prevented if we had more investment in hospitals and in covering everyone, and there's been studies that show that like if we had just let the virus run its course, like our economy would lose almost $6 trillion. So like there there are other costs to our system that aren't always like recognizable.
Well, yeah, I mean, the uninsured and underinsured cost, like they end up costing us money too. Like, if that makes sense.
Yeah.
Um, but yeah, I definitely think the coronavirus has highlighted a lot of flaws within our healthcare system. Um, but yeah, I'm just saying we could do like a super long episode or series on like healthcare in general. Like, it's a huge topic.
Well, right. Um, but hopefully this has provided enough of a like enough coverage where you the viewer can kind of take this, and hopefully it gets you thinking a little differently about healthcare in the United States and what the pandemic means for our healthcare system. And obviously, Courtney and I mean these as kind of like conversation starters. Like, we obviously haven't like figured everything out.
So
like
definitely
Courtney said,
leave
like
a comment if you want some extra discussion.
definitely. And yeah, like we could, like Courtney said, we could talk for hours on this, but I think we'll sign off for now.